Thank you for joining me today for this course. It's entitled Tube to Breast, Navigating the Transition from Enteral Feeding to Breastfeeding. I will be your instructor throughout the course. My name is Kelly Andrasic-McLeod, and it's nice to virtually meet you. So, a little background about myself. I'm an occupational therapist and I've been practicing for almost 14 years now. Even when I was in OT school, I knew that I was drawn to work with medically fragile patients and really have the opportunity to help people during a really challenging and also complex time in their life. So I started working with adult acute care and adult inpatient rehab, and over the years have transitioned to doing solely pediatrics, most of which is helping neonates within the intensive care unit. I also work with older pediatric clients and NICU graduates and focus a lot on developmental disorders and also providing the feeding and swallowing support. So I just love being an OT. I love the flexibility that the profession provides and the opportunity I've had to work with a variety of patients and have, flexibility to help them through some really hard times. So, my real love as an OT is working within the NICU. And so, I am a neonatal therapist certified by the National Neonatal Therapy National Certification Board. I sat for that board examination when it very first came out just a few years ago. And then I'm also a really passionate supporter of safe feeding plan, preferably at the breast as the baby and family desire. So because of that, I pursued sitting for the International Board Certified Lactation Consultant exam about 3 years ago. And so have an IBCLC, have that acronym as well. And I also am kind of like a lifelong learner and also love teaching. So a few years ago, I decided to pursue my doctorate in occupational therapy through Kansas University Medical Center. And I'm now one of their adjunct faculty. So when I was there, my capstone project focused on improving breastfeeding outcomes and what OT's role is for supporting medically fragile babies with their breastfeeding journey. So, a couple pictures just so you can see a little bit about my life as outside of being an occupational therapist. This is a picture of my son Elliot. He is a pandemic baby and was born a couple weeks before the world shut down. And he's now a year and a half old as we record this course, and things haven't opened up or changed a whole lot in the hospital setting, at least. So I like to say that, even all the training that I've received and different certifications that I've done, nothing taught me more and humbled me more about the breastfeeding journey than working through breastfeeding this little guy. So, as a formality, I do have disclosures to share. I'm an OT at a large Bay Area teaching hospital, and everything I talk about today is my own experience and own ideas and doesn't reflect where I work. I'm on the clinical advisory board for Lansino Laboratories Incorporated, and I am doing some consulting right now for Dr. Brown's Medical, where I'll be working on creating a specialized breastfeeding specific module for the infant driven feeding program. And finally, I receive royalties from the lactation OT for this course, obviously, and another course, which is entitled Breastfeeding Assessment and Intervention for the Medically Fragile Infant. So, our objectives by the end of this course, you will be able to list at least 3 reasons why infants may need enteral tube feedings, identify key differences between continuous and bolus tube feedings that have implications for when we are talking about weaning tube feedings. Describe 3 ways to promote a positive introduction to breastfeeding for infants who are tube fed. You will be able to recognize 3 specific things that must be in place before weaning enteral feedings for breastfed infants. Identify 3 red flags when working on weaning enteral feedings with an infant that would warrant further evaluation from a medical provider. And recall unique considerations between weaning an infant who is tube fed and a child who is tube